Hi, I'm Matt Hongoltz-Hetling, journalist.
And I'm Michael Seamans, photojournalist. We're reporting from Sierra Leone, a country that's received a lot of attention over the past year because of its problems with Ebola, a flesh-eating virus that's killed about 3,800 people in the nation.
Apart from that Ebola, them picking their food they die.
But not everything made the news. We heard about how Ebola's spread was hastened because people fled treatment centers, but we didn't hear much about why they fled. We heard about the 3,800 deaths, but we didn't hear about the 39,000 children under age 5 who are dying every year, often of entirely preventable causes, like pneumonia, diarrhea, malaria, and the measles.
Our reporting project documents the connection between many of these deaths and a massive cultural gap between doctors and traditional faith healers. Doctors are the best at keeping newborn babies alive, but traditional healers are the best at gaining and keeping the trust of women and families.
That dynamic is at play here in rural Kono, where the haves live in homes of concrete with tin roofs, and the have-nots live in homes of mud and palm fronds, often without electricity or running water.
Here in Kono, as in many places throughout the country, some of the poorest people in the world are routinely asked to pay bribes in order to receive health care. Health care that they have a legal right to access for free.
But it's not all bad news. These seemingly intractable problems are being tackled by a small NGO that exists as a partnership between the people of Kono and the United States. Called the Wellbody Alliance, they've come up with an innovative healthcare delivery model that's brought doctors and traditional faith healers together to deliver infants in a way that both saves lives and has the support of local mothers. Just this week, the delivery center saw its first birth when it helped to bring Alison Fengai Kamara into the world.
Incredibly, this was just hours after Alicine's twin sister, Lansana Fengai Kamara, was born at home. We're here to evaluate whether this program seems to be working and whether it could be replicated in other parts of the world that are experiencing similar issues.
The support of the Pulitzer Center for Crisis Reporting and the Solutions Journalism Network have allowed us to bring this and other stories from the people of Kono to the international community.